right, welcome everyone to episode 7 of this Facebook Live series where Dr. Steele and Newton will be discussing the topic, countering mental health stigma in BIPOC communities. I'm going to get us started by introducing myself. My name is Tatyana Smith, and I'm going to be the moderator for our conversation this evening. I am a counseling psychology doctoral student at Western Michigan University and a therapist in the Counseling Center at WMU Syndicuse Health Center. So Dr. Shamika Newton is the co-author of the newly released book, Black Lives Are Beautiful, 50 Tools to Heal from Trauma and Promote Positive Racial Identity, published through Routledge and imprint of Taylor and Francis Group, LLC. She's also a fully licensed psychologist and owner of Legacy Mental Health Services, PLLC. Dr. Char has over 10 years of experience in clinical, academic, and community settings, including teaching experience at both undergraduate and graduate levels of higher education. Her areas of expertise include multicultural of master's level counseling practitioners and students. In addition to her clinical and teaching expertise, Dr. Newton is also a member of the Michigan Board of Psychology, appointed by Governor Gretchen Whitmer, and she was recently honored with the Distinguished Psychologist Award by the Michigan Psychological Association. Next, Dr. Janeé Steele is the other author of Black Lives Are Beautiful and a licensed professional counselor, counselor educator, and diplomat of the Academy of Cognitive and Behavioral Therapies. Dr. Steele is also the owner and clinical director of Kalamazoo Cognitive and Behavioral Therapy, PLLC, where she provides therapy, supervision, and training in CBT. Her scholarly activity includes peer-reviewed articles focused on CBT, social justice advocacy, and counselor training. Her favorite article describes cognitive conceptualization and treatment planning using CBT and a proposed cognitive model of internalized racism. Her webinar discussing the proposed cognitive model of internalized racism is one of the American Counseling Association's best-selling products and was featured by the organization as part of its 2022 BIPOC Awareness Month programming. So tonight we'll be talking about mental health issues in the BIPOC community, including the mental health effects of racism. We recognize that conversations about these issues can be painful. With that in mind, we always like to begin with a reminder about the importance of self-care and mindfulness during our time together. If you find anything to be overwhelming or are a target of oppression, please be sure to use mindfulness and breathing skills when you need to and to take a break if necessary. If you are an ally or a learner, work toward maintaining a non-judgmental stance, recognize any defensiveness you may be experiencing, and listen with the intention of understanding and learning. We also invite you to apply the coping skills we'll discuss this evening. So with that said, keep in mind that our conversation tonight is not a substitute for mental health or medical advice, and you should seek appropriate help where needed. Now we're going to get started. So my first question that I have for you both is, in some BIPOC communities, anti-therapy messages are often hidden in certain sayings. So we're going to look at one common saying, and that is, what happens in this house stays in this house. So how can this message stop us from healing, and how might this message be countered or looked at differently as it relates to therapy?
I think, something that's important for me to emphasize is that mental health broadly in BIPOC communities is a complex issue. As it relates to professional help seeking, on the one hand, we have an issue wherein there is often a lack of cultural responsiveness in the services that are provided to clients. And then that coupled with the low numbers of mental health professionals who are also people of color can result in the underutilization of mental health services or issues with treatment outcomes such as early termination or worsening of symptoms. So we have that issue on one hand, which affects mental health and professional help seeking in that community. But then on the other hand, as we're emphasizing tonight, we also have struggles with normative beliefs in these communities that also contribute to the underutilization of mental health services within this community. And so attitudes that are reflected in this belief, what happens in this house stays in this house, can prevent individuals who belong to BIPOC communities from healing, because it reinforces this idea that if you are struggling with your mental health, it's something that you should be ashamed of. And it also reinforces the idea if you shouldn't be ashamed. You should at least be strong enough to handle these issues on your own. And it's something that you really shouldn't talk about, especially outside of the house. And so I think that that's one way that that attitude is reflected in that saying, and part of the consequence for BIPOC community as it relates to mental health.
Yeah, and I would just add, I think for BIPOC populations, a lot of times it goes back to the idea that when we're hurt, we tend to retreat. And so if you look at like the history of African Americans, indigenous populations, there's been a lot of hurt that's occurred within this country because of systems. And so then now you want me to go outside of my home, outside of maybe that safe zone, and talk to someone who I don't know, who may be of a different race than me. That's a big risk that I'm taking as an individual. And then so that keeps individuals from seeking out help. But then at the same time, as Dr. Janeé was saying, it keeps individuals from healing and from moving forward. So I think a lot of times that notion of, what happens in this house stays in this house is based off of distrust of systems, distrust of people of authority, because we've, as BIPOC populations, have had negative experiences with structures,
Yeah, I think another way too that I've heard BIPOC clients and community members phrase this is we don't air out our dirty laundry. And I think that, goes back to what you were talking about, Dr. Steele, and also you as well, Dr. Noon, about, the low numbers of BIPOC providers and just the cultural mistrust that exists with BIPOC clients and community members interacting with medical and other health service organizations. I think there's a very real fear in these communities, and rightfully so because of their history in the United States of, confirming certain stereotypes about their cultural groups if they do disclose they're having mental health challenges. But again, I think, the benefits outweigh the risk, in my opinion, because these messages, shut down people from being able to be authentic about their experiences and the real pain and trauma that they're trying to figure out how to navigate in the best way possible. When I think about help seeking as well, it shuts down vulnerability and honest emotional expression. And then it just creates like a culture of silence around like our painful experiences. And I feel like this directly impacts our ability as BIPOC folks to be able to liberate ourselves from the mental health challenges we are experiencing.
Mm-hmm. And I think what you both are saying as it relates to systems is so important, because another key issue is the fact that many people of color enter into mental health systems as some type of punishment. So whether that is through CPS or through a parole system, or through, even if it's through, like some type of drug court, where mental health counseling becomes part of their legal sentencing, it's, there's often a punitive connotation to the receipt of mental health services. And so for many people, that can contribute to those elements of cultural mistrust that are related to the receipt of mental health services, and reinforce this idea that sharing your mental health concerns can result in some type of punishment or negative harm.
Yeah, that there's those consequences that come from identifying that you need help. And I think the other part that may keep things within the house per se is the idea or the fear of being misunderstood, that people won't understand your cultural background. And I think back to when I was an intern on my doctoral studies, and I was just supposed to be observing a session with a white male clinician, and a grandmother and she was bringing her grandson in, who she was basically taking care of. And the clinician was asking the grandmother the question of, does your grandson understand social cues? Well, this grandmother was like 70 years old. She didn't understand the word social cues. And the clinician, he struggled to break down like what he meant. So I was like, okay, if you give your grandson the look, does he understand that he needs to stop acting up and sit down someplace? And she was like, yeah. And then she went on, because she was able to grasp what was being asked of her. And so I think sometimes clients may fear coming into therapy because they may fear not being understood, or there may even be a power differential, educational difference, and then that creates a blockage from them seeking help. Because his grandmother, when I started talking to her, she just opened up and started telling me more about the grandson. But when the male clinician, he was so structured and so textbook with her, he wasn't getting through. And so I think some of that also creates, we're just gonna keep it in the house because I don't want to cross that barrier or that
And those
difficulty.
power differentials that you're talking about are important too, especially as it relates to the cultural responsiveness of services. And those apply to clinicians of color as well, because, there might be similarities based on race or experience as a person of color if you don't belong to the same race or ethnicity, but then there may be differences according to socioeconomic status or educational level that still can be intimidating to people coming into therapy if they differ from you. And so that's something that's important to keep in mind as well.
Mhm.
Yeah, I agree with both of what you both just shared. And I kind of want to circle back to the second part of this question. In your perspective, how might this message of what happens in the house, stays in this house, be countered or looked at differently as it relates to therapy so that more people from BIPOC communities can be encouraged to seek mental health support when they need it?
So, I mean, I think if you're a member of the BIPOC population and that's been a message you've been given, I would encourage you to think about that thought. So if it stays in the house, does abuse stay in the house? Does negative messages, ways of functioning stay in the house? And then you bring it to your new house, your new family. And so I would challenge that in order for us as people of color really to heal, we do have to reach outward, and we have to realize that that message of what stays in the house, well, it may mean that you stay unhealthy, which isn't a good thing. And so we have to challenge like our thoughts, I think, about that notion and look at how that may serve a purpose and that may be a form of self-protection. But at the end of the day, like if you don't reach out, are you replicating some of the unhealthy behaviors or patterns in your current home or life?
Mhm. And I think as mental health professionals, it's also important that we're active in reaching these communities and increasing awareness. Awareness as it relates to the psychological harm that comes from not talking about your problems. So things like Dr. Char was talking about in terms of perpetuating cycles of abuse or just psychological distress in the home when we don't talk about it outside of the home. And then also being more open about the benefits of receiving psychological help. So you'll probably feel better. You'll learn some better coping strategies, and you'll experience a better quality of life if you are able to get the help that you need.
I agree. And I'll add too, because I feel like this message is very relevant in the work that I do, even with college students, who are part of BIPOC communities. For college students, a lot of times this is their first, experience of therapy. So they come into the room, very nervous, very timid, with all these, preconceived notions, or I don't know how you expect me to show up in this space. So a message that I've used to help counter the stigma around mental health, talking about it and coming in therapy is just because we don't talk about things, it doesn't make our issues magically go away. You're still going to be experiencing abuse, trauma, and oppression. So at what point do we, enter in and break the chain? And I like what you both are talking about, the outreach piece with this, especially as BIPOC clinicians, is important because it's a part of our job too as therapists to provide that psychoeducation to demystify what therapy is, the process, talk to clients about their expectations for what they're hoping to get out of that space, because therapy is meant to be a safe space for you to be able to confront, your mental health challenges. And therapists who work from a culturally informed framework, they can be a part of the BIPOC community themselves or not, but if they are coming to therapy with that culturally informed lens, they can bear witness to and validate your experiences of oppression and trauma and things like and abuse, including with your family, but also help clients to develop compassion and empathy for the scars that their family has endured, as a result of history and just, existing on a daily in the United States, which for a lot of us, those scars that our family has endured, like generationally, has colored the messages we've received about mental health. So not only does therapy help to liberate the client, they can then take this re-education back to their community and liberate, their broader communities.
Mhm.
So the next message we've heard about is specifically with BIPOC men, receiving the message of man up or real men don't cry. What messages would you say these sayings send to BIPOC men, and how can therapy help men to deal with emotions or get comfortable with them?
Well, I think African American men, like men of other communities, are socialized to refrain from expressing feelings of helplessness or vulnerability. And so as a result of that, they may be experiencing symptoms related to depression or other mental health concerns, but they won't talk about them. Some of those symptoms that might be perceived as representing weakness. Conversely, they may feel more comfortable expressing symptoms that are stereotypically more masculine, so things like anger or acting out. And so this hurts BIPOC men because, one, they're not allowed to express their full humanity, and that hurts anyone in that situation. Two, even when they do seek treatment, they may not get the treatment they need, or they may be misdiagnosed because they're denying or omitting some of the symptoms that they're experiencing. Additionally, they may be subjected to stereotypes or biases by the clinician because just like the men themselves are socialized, everyone else in society receives those same messages. And so they might be perceived as more aggressive, and superficially that might confirm the clinician's biases, and they might not explore or conduct the type of assessment to truly find out what's going on with that individual. And so, I guess I would summarize that by saying that those messages that BIPOC men are receiving are preventing them often from expressing their most full, or making their most full expression of how they're feeling. And then that as a result can lead to a misdiagnosis or poor treatment when they do seek help.
Mhm. Most definitely. As I think about this question, I think about like the fragmented nature of the Black, like for example, for Black Americans, the fragmented nature of the Black family, where a lot of Black Americans, not all, but a lot, do grow up without Black males in the home. And so the modeling of maybe how does a male express emotion, how does a male cope with difficult times may not be there. And so sometimes we, or Black men particularly, are left to kind of figure it out on their own of what manhood looks like. And then that may again lead to some messaging that is counter them really taking care of their mental, their emotional health, because of the Black family structure, for example, just using that population, not being intact all the time. So it's like, well, what is a male? What does that look like? Is that aggressive? Is that, what messages does that lead for the individual to seek out? And so then some individuals, some cultures may be left figuring it out on their own, which can then lead to more problems as it relates to emotional or mental health.
Yeah, and I think to kind of like summarize a little bit of what we're talking about, like we're basically providing like the context in which Black men are socialized about emotional expression and vulnerability. So, recognizing that many Black men are navigating multiple intersecting systems of oppression, like white patriarchy, racism, sexism, which all these systems work in tandem to provide BIPOC men, and in particular Black men, with very narrow scripts for manhood and masculinity and healing practices for overcoming trauma and oppression. And so, as you both have already iterated, these messages communicate to men that it's not appropriate or safe even to express their emotions, including anger, like you mentioned, Dr. Steele, which a lot of times I've found for Black men are really driven by their sadness, that they cannot be their full human self. And unfortunately, just like you were saying earlier, not only are men receiving these messages and are being socialized in this way, but also other men, women in society at large, and it's suffocating. I mean, I think about someone crying by themselves in a corner. That's literally the experience of BIPOC men in terms of navigating their emotional experiences. And I think about for Black men in particular, these messages also have historical implications because for many Black men and boys, they were continuously being advised to either hide or suppress their emotions, especially in the presence of white people, because expressing your emotions, especially anger, could get you hurt or killed.
Mm-hmm. Mm-hmm. And I think that historical and that racial context is also important from the other end of the spectrum in terms of the experiences BIPOC men have with discrimination. Discrimination at its core is disempowering and it can make you feel helpless. And so in some ways, not expressing that helplessness or vulnerability and appearing strong can be a coping strategy for that experience of discrimination and the consequential feelings of helplessness and vulnerability that occur as a result.
And I think you were getting to this piece a little bit too, Dr. Newton, about how how do BIPOC men then cope under these messages and the pressure that it creates? I've seen instances in the literature and in my work with BIPOC male clients, they become silent, they become more reserved, some may become more hostile or cynical and distrusting of people in relationships because of the experiences they've had, especially those experiences of racial discrimination. They may also sometimes, unfortunately, engage in substance use to kind of numb the pain or other risky behaviors, especially when we think about sex and the messages that BIPOC men receive around that, just to name a few. So again, I think all of these messages stop BIPOC men from experiencing their full humanity, their authenticity, being vulnerable, being able to experience intimacy, and also getting the social support they need.
Mm-hmm. Mm-hmm. And you talked a lot about passive and even some negative coping strategies, but there are also some coping strategies that men may be implementing that may seem benign, but actually have those same effects that we've been talking about. And I'm thinking about how a desire for muscularity in some respects is also representative of a negative coping strategy that may seem positive, but it's rooted in that idea that I have to be masculine and I can project my masculinity by being muscular. And then that becomes another mask that provides a level of distance between them and the expression of their emotions.
So to circle back to the second part of this question, how would you both say that therapy can be useful to BIPOC men in terms of giving them that space to process and get in touch with their emotions?
I would say that that BIPOC men is taking that risk of being vulnerable with someone else, even if you feel comfortable maybe meeting with another male. But taking that risk to be vulnerable and open up the conversation, I think is important. And also like doing the check-ins with yourself, like we just mentioned, like sometimes when I'm angry, am I really sad? Is that what's really going on here? Like, am I sad or disappointed? Is there a softer emotion going on? So I think additional step is BIPOC men being aware of like just their emotional state, and even looking at just, ways in which you can begin to trust other men, like let other men in, if that's males at your church, your place of worship, or looking at ways in your community that you can even connect, because maybe the first step isn't therapy for you. Maybe the first step is just trusting someone else with your story, with your life. I think that's, some initial steps that could be taken.
Mhm. And I'd say for me, critical consciousness is a big piece of this. And so, working with someone to make those implicit messages that they've received about manhood and masculinity explicit. And then once doing that, working to define for themselves what manhood means to them as individuals or for their family or even maybe in their community. And then after developing that definition, evaluating how well the way that they currently deal with their emotions supports that definition and how or what changes need to be made in terms of what's not lining up to support that.
And as you say that, it makes me to think, it causes me to think about the ideal of there need to be some understanding of the people maybe who have dropped us. And so sometimes, like when I was talking about earlier, sometimes in Black communities, like Black fathers may be absent in some instances. Going back and thinking about the individuals maybe who dropped us, and there may need to be some healing that occurs before we can move on and create those new definitions, and understanding of how that, what I'll say dropping, how that impacts how we view manhood and the messages that we have about ourselves.
Yeah, I really like the way that you just phrased that, Dr. Noon, understanding the people that have dropped us who were absent during those times where we really needed emotional support. I think because all of this, providing men with the safe space to like even name that like I have emotions, like to normalize that feelings are normal for men and that it's okay to express emotion and their feelings are valid. I also think about too in terms of like self-awareness around like emotional vulnerability and expression. Sometimes it might be helpful too to like go back to the basics and like when you're in therapy with a BIPOC man, like providing them with a feeling wheel to help them better articulate like the breadth and depth of their emotions, as opposed to like this binary system of BIPOC men can only express and feel anger versus happiness or weakness versus strength, so they can understand like the complexity of their emotional experience. And I feel like in this way, therapy then works to reframe emotional vulnerability as a sign of strength as opposed to weakness, a way of resilience, and also like what you're speaking to, like that radical healing framework, Dr. Steele, that critical resistance too, especially in multiple systems of oppression that tell you that you have to be strong all the time and you can't show emotions or it's a sign of weakness.
Yeah, those are all good points. And I think, as clinicians specifically, it's also important that we don't underestimate the potential for the therapeutic relationship to be reparative. I know in BIPOC communities, we talk a lot about absent fathers, but at least among the Black men that I've seen in my practice, it seems like a good deal of hurt comes from mothers as well. And so it's really important that we're able to provide the safety that these men need to talk about the hurt that they've experienced in these relationships, and even to name it, sometimes to help them name it, because sometimes it just seems normal and they don't really understand what's gone on. They don't really understand the trauma that has occurred or even that it was traumatic. And so it's really important that we're able to affirm and validate those experiences and help them to articulate it so that they can begin to experience healing, and to not replicate the hurt in therapeutic relationship itself.
Yeah, and I want to jump in because I feel like we're getting to the deep stuff now. So what you just said there, Dr. Steele, and we were talking about it, before we got on this podcast, but underestimating the role that mothers play in socializing young men and boys about emotional expression and vulnerability, and how much we underestimate their impact, especially when I think about Black men, because my research, focuses on Black men with histories of childhood sexual abuse, and that is something that has come up, in the midst of data collection, but understanding, like, particular for Black mothers, because, men are removed from the home in so many ways, right? So high mortality rates, death, mass incarceration, police brutality, discrimination, being stuck in low wage jobs. How much of the responsibility is left on Black mothers to socialize their sons about emotional expression and vulnerability, like symbolically of masculinity, like this is how you're supposed to walk, talk, present yourself and be, and the real hurt and damage that can be sustained when you're getting messages from your mom that, as a Black man in particular, you shouldn't cry, you shouldn't complain, you should be strong. At this point, like I actually heard one participant say to me, you should be used to experiencing pain. And that's like, whoa. So again, I think too, speaking to that piece and like being a Black woman therapist and using myself as a tool in therapy to provide like that corrective emotional experience, because again, like helping them to understand like mom is maybe somebody that dropped them, but also understanding the scars that mom has endured that's colored the way that she socialized you, because as much as you are hurting that your father's not present in the home, she is as well. And the community as a broader collective is hurting as well. So I feel like you said something really deep there.
Yeah. And I think, that potential for hurt, it extends beyond even just how, like what the mothers are teaching them about being men. Sometimes it just occurs directly in the relationship itself. And often, as you stated, Tatyana, like as a result of the unresolved issues that the parent is experiencing, within themselves. I can think about one client, the biggest hurt that he had been dealing with for maybe the 10 years that he had been an adult was hurt that he experienced in the relationship with his grandmother who had raised him. He described his grandmother as his best friend. And then when he got a little bit older, he had a baby. And from that point on, his grandmother treated him just like every other stereotypical Black man that thinks has a baby and doesn't take care of it, even though that wasn't his experience. That was the way that she treated him. And so he was constantly living his life trying to prove to her that he was good enough, that he wasn't like that, trying to regain that relationship. But at the same time, feeling that it was hopeless and that it was gone forever because you can't go back in time and change the way that things are now. And so, there's something specific to the socialization that BIPOC men are experiencing, but also just to the everyday kind of relational issues that they're experiencing in their families as well.
Yeah, and I think that if we zoom out, it just speaks to the unfortunate nature of, even in this example with your client and his experiences with his grandmother, the harm that comes from BIPOC families having to exist in these oppressive systems that color our interactions, because truly, like, these are not our ways, our indigenous ways of being and relating with each other. But these systems, they really impede our ability to like form healthy attachments with each other. And I was thinking more along this question too about just more like specific techniques that might be helpful for BIPOC men in terms of helping them to get in touch with and process and name and work through their emotions. Things like poetry and bibliotherapy and expressive writing and art therapy can all be helpful ways to help BIPOC men process their emotions, especially as it relates to their experience of manhood and masculinity, and like what you were speaking to, Dr. Steele, like the scripts they've received and what that personally means to them. You both have talked about in other podcast episodes the importance of body-centric strategies like grounding and mindfulness. Like you were talking about, Dr. Newton, like just being more aware of like, what am I actually feeling in this moment? Just to help them connect their emotions to bodily sensations. And I think above all, learning how to be emotionally expressive and vulnerable for BIPOC men is really to their benefit, because it helps to increase their emotional intelligence and reclaim their power as racial beings. Because our emotions provide us with a wealth of information about our mental health and our well-being. So if we like cut off that experience, we're missing so much that like makes us who we are.
Mhm. And I think the other part is also just looking at culturally normal ways in which, like, for example, Black men may connect with each other. It may not be on the golf course, right? And for some Black men, it may be, but it may be at the barbershop, or it may be playing basketball, looking at like just culturally
Or the
normal
strip
ways.
club.
Stop. Okay. Yeah, okay, yeah, that too.
You know.
There are just different ways in which we as Black folks, we connect with one another, and other BIPOC populations as well connect with each other. And so I think it's important for us to look at those places as ways in which we can test out those skills that we would get into therapy, like building trust with, my boys when I go to hoop, or, building trust in different community events. So.
Yeah, and last thing I'll add, just because it made me think of you all's book that we're going to plug at the end, those tools for promoting positive racial identity development. One of the things you all talk about in terms of, it was a chapter on where you talk about community, the trust in a community that BIPOC men who are part of Greek organizations experience. That's another avenue for them to be able to relate and build trust with other men. So the next message we're going to talk about then is, you've got to be crazy to go to therapy, and I'm not crazy. What are your thoughts about this message, and do you think that it's true?
I think for me, just simple statistics is enough to kind of like squash that idea. A recent survey from SAMHSA showed that 11.7% of Black people report experiencing psychological distress, whereas 12.1% of white people report experiencing psychological distress. So essentially, the amount of people in both groups experiencing psychological distress are the same. However, only 25% of African Americans seek therapy, whereas I think it's like 40% of white people seek therapy. And so for me, whether you go to therapy or not, you're still experiencing these issues. We're still experiencing these issues at the same rates other groups are. And so it can only benefit you, provided that you meet with an appropriate clinician, but it can only benefit you for you to get the help that you need. It doesn't change your experiential reality, or necessarily that label doesn't change like qualitatively what's happening in your life to point you in that direction.
And I think it's also, when we talk about like demystifying therapy, you don't have to be so extreme to go to therapy. You could just be dealing with life transitions. Like, I had a son a year and a half ago. I went to therapy when I first graduated from my doctorate program, and I was trying to navigate a dating relationship and being a young professional. I went to therapy, and I think it's valuable because it gives you new perspectives on life, and you don't have to be crazy just to be dealing with life transitions. And I'll just share real quickly, like when I was in therapy, my first encounter was with a therapist who was very helpful. And I was dealing with, again, new professional dating relationship things. And at the same time, my grandfather passed. So a life transition happened. My grandfather passed. And I was like, I'm not going to the funeral because I wasn't that close with him like I was my mom's dad. So I'm not going to the funeral, right? I don't want to go. And so, but I was torn because it's my grandfather, and the right thing, I guess, to do is to go to the funeral. And so I talked with my therapist about it, and she was like, why do people go to funerals? And I was like, to pay their respects to dad, right? And that was my perspective, to pay their respects to dad. And she's like, is that really why people go to funeral, Char? And I was like, yes. And she was like, or do people go to support the living? And like the light bulb went off my head. I was like, this lady just changed my whole perspective. I'm going to the funeral because I have a strong relationship with my dad and my brother, and they were closer with my grandfather. So I want to support the living as well as be there for them. And so I think just getting new perspectives on things doesn't make you crazy. It makes you wanting to be informed and to be able to do things that honor you, honor your value system.
Yeah, I wholeheartedly agree with that messaging, Dr. Moonlight, because to me, the simplest way that I can describe the benefits of therapy is, it really is meant, if you, just like you said, Dr. Steele, if you are working with somebody that is appropriate and is a therapist for you, then it's meant to be a safe space where you can just have protected time to check in with yourself. I think about how busy we are as human beings and how hard it is for us to find time to prioritize self-care and soul care. That is your protected time where you just get to talk about you and everything that's going on in your life. And the therapist gets paid to listen to you. You don't have to be certified crazy to attend. And in fact, to counter this message that you have to be crazy to go to therapy, many clients who attend therapy, just as you were saying, Dr. Noon, are what we term the worried well. Like they are regular, everyday people who are going to therapy because they're trying to figure out what is going to be the healthiest way for them to navigate, these everyday challenges that they face. So for me, therapy is meant to be a space where you feel seen, you feel heard, you feel validated, you're working towards your own healing and liberation. I think when we get caught up in this messaging in the BIPOC community, like it prevents us from being able to like decolonize our minds and like break those mental chains, because just like we were talking about earlier, just because you ignore the problem doesn't magically make it go away. Like just like you were saying, Dr. Steele, doesn't qualitatively change what you're experiencing every day.
Mm-hmm. Yep.
And I think if you also use just like, you think about mental health, we think about physical health, like we go for regular checkups when we have a problem, like we'll go to the doctor, if we're experiencing some sort of ailment within our body, like we have to take care of our bodies, but then we also take care of our minds and our physical health as well. And that's just self-love. So I think it's all how you conceptualize it, that, taking the time, like you were saying, Tatyana, about just your sacred space, it's self-love. Like if we love ourselves, we got to take care of our physical bodies and we got to take care of our emotional states as well. And that doesn't make you crazy, it makes you healthy.
Mm-hmm. And I think, even if you're going to therapy just for like some type of developmental or transitional issue, that's fine. But if you have a more severe psychiatric need, it's super important that you go to therapy, because we know from social media that society is a lot less forgiving of people of color who have mental health issues than they are of the dominant racial group. So, the consequences can be more dire. It can lead to homelessness. It can lead to losing your job. It can lead to alcoholism, which could lead to you hurting yourself or someone else. And so it's important, wherever you're at on that spectrum, if you just feel like you want to talk to somebody, or if you need help, the labels, they don't matter. Just get the help that you need.
I agree. So the last message is, and this is one I feel like is very common in the Black community, is baby, just trust Jesus and everything will be all right. How do you think this message hurts people dealing with mental health concerns, and what message can we give as religious or spiritual beings?
Think, for me, being respectful of a person's spiritual worldview is an important part of cultural responsiveness. And so I would just advise that person search their own religious texts for an answer to that question. I think that, most people of like a formalized religious faith would find that their text suggests that God uses people to help each other. And so if God uses people, uses us to help one another, then perhaps I can be one of the people that he's placed here to help you. And you can have a therapist and your religious faith at the same time.
Mm-hmm. Yeah, and I think when people of faith give that message, I think it's, I'll be direct. I just say I think that's minimizing. I think that's minimizing of the reality and what we know. There is definitely, I'm a believer. I believe there's power in prayer. I believe that Jesus is a healer, right? But then, like Dr. Steele was saying, we also need help. right? And God equips people to help us. He gives us gifts. He gives us knowledge. And we can't, we shouldn't minimize people's lived experiences by saying, well, just pray about it, right? Because you can pray about it, but you may also need to talk to someone who can equip you with skills, or, you know, get the help that you need, in addition to practicing your faith. So I think it's important to do both. They're not, mutually exclusive. It doesn't make you weak in your faith to do so.
Yeah, I think of the saying, there's more than one way to skin a cat. So there's more than one way to improve your mental health. Like, you can have multiple forms of support, and therapy can be one of them, just as well as your faith. And I'm also, a believer of Christ myself. And I really didn't resonate with what you were just saying, Dr. Steele, and you as well, Dr. Newton, that therapists are meant to be vessels, right? That God works through to provide people with healing. And I know for myself, and being a therapist, but also going to therapy, we're always good about listening for a word from God about what we should be doing in a particular situation. But most of us can listen to people we trust, like our therapists. And I think especially in Black and Indigenous cultures, therapists then can hold sacred positions in our communities as witnesses to our pain and co-journeyers with other people in their path toward healing and liberation. So
and I think that what Tatyana is saying really resonates with some of the comments that we have on the Facebook. Enid says that getting help doesn't mean that you lack faith, and therapists are meant to be vessels. And so, I think that just reinforces this notion that really therapy, it is a system, and, there is somewhat of a prescribed way that system operates, but it's also about what you as the individual brings to the therapeutic context. So if you are a spiritual person and you bring that into your therapy, then your therapy becomes spiritual because you're there. And so in that way, therapy can continue to be compatible with your faith as well.
And what I wanted to add is that, again, like following along this line of, and bringing in spirituality and faith and religion into therapy, you being a spiritual being, right, and coming to therapy with your therapist, who is also a spiritual being, allows that person to complete their God-given assignment, which is to be a healer, right, and to help you in your time of need. So, like, there's a synergy, like, when we're interconnected in that way, like, it really benefits both of us. Like, it's a win-win situation.
Yeah, when I think about it, it's also, I think, just being obedient to, just also scripture. Just like, God doesn't want us to be unhealthy. He wants us to live abundant life. He came that, we may live abundant life based off my faith. And so I can't live abundant life if I'm dealing with depression, I'm never getting help, or I'm dealing with anxiety, but I'm not able to cope with it and to manage it, right? So some of our purpose that God's gifted and given to us is going to be hindered unless we are truly working on ourselves and working on ourselves in the spiritual component, but then also working on ourselves through our mental health as well.
Mm-hmm. Yeah, and that, reinforces another comment from another viewer that says, sometimes your relationship with God might be solid, but you might still experience challenges with your mental health. And that's, absolutely true. Experiencing challenges with your mental health is not necessarily an indicator that you lack faith, but it can simply be perhaps that you're human. And we all experience challenges with our mental health at some point.
And I was going to add, I think, for clinicians who are watching or will watch, I think also that's a great opportunity to partner, because we as clinicians, we can't operate like in a vacuum when people are operating in community. So partnering with like faith-based organizations to offer services or offer support or to see how you can collaborate, I think is important. Because in some BIPOC communities, like faith-based organizations they're credible. They're credible for people, and they're entities that people trust. Because going back to that very first question, we as BIPOC sometimes aren't able to trust because of those experiences. So I think, we don't have to work in opposition, like mental health professionals don't have to work in opposition with faith-based organizations. In fact, I think it's probably best to collaborate to provide help.
Mhm. And I know this is a little different from the question, but in terms of that collaborative relationship between mental health professionals and faith-based organizations, I also think that that speaks to the value that, you know, mental health professionals can bring to faith-based organizations in terms of their role as like social advocates in the community, and the clinicians work as a scientist practitioner. And so we have a level of expertise that can speak to the experiences that people of color encounter, that cause psychological harm, things like racism or other forms of discrimination and oppression. We have a unique understanding of that, and we can add our scientific understanding to the work that these organizations are doing to improve the lives, but tangentially also the mental health of individuals as well.
And I think you're getting onto something, Dr. Steele, right? Like, you bring up the scientist practitioner model. Psychological science does not have to work in opposition to God. He created psychology. Like, if people didn't know that, right? So I think, yeah, that outreach piece, working in tandem, because we are interconnected. We're both, healers in this community, works to the benefit of communities, because on the one hand, you are bringing in cultural values of spirituality and religion that people hold so dear to them, while also being able to bring in psychological science to just provide a better understanding, or just kind of like just add a little more color to the picture, and fill in the gaps. So again, like the synergy, man does not have to be in opposition with God, right?
Yeah.
Mm-hmm. Mm-hmm.
Okay, so then if someone is wanting to seek help, how can they do so? How would you advise people who are listening or who are going to listen to go about finding a therapist?
I would say for me, one of the first things is to identify what you value in a therapist. Like, do you want somebody who's going to challenge you? Do you want somebody who's directive? What do you value, or what would you appreciate about a therapist? I think that's important, first of all, for you to define that, because then when you start your search, you'll know what you're looking for. And then there are just resources that are out there, like Therapy for Black Girl is a resource. Psychology Today is a resource where you just type in like your zip code and you can find therapists and read their bios. And also, some therapists offer like consultation where they'll meet with you for, say, 15 minutes or 20 minutes, and they'll talk to you about kind of their style. And the other thing I say, come prepared with questions. It's your opportunity to get to know them, to make sure it's a match, but come with questions that you may have for your therapist. Like, do they assign homework? What's their style of working with clients? How long they've been doing this? Like, anything that you're wondering, treat it as an opportunity just to not share, but to gather information about, is this a match? And I think if it's not a match, that's okay, because you want to find the person that, as we said before, that best fits you. So I think that that's important as well. But using those resources, the databases like Therapy for Black Girl, Psychology Today, can at least get you to some profiles. But then also, I would say, probably come with things that you want to ask and things that your expectation or your values in the relationship would include.
And a lot of communities are developing directories of clinicians of color. And so sometimes a Google search can be a great place to start. Just entering the term clinicians of colors, that might get you a list of therapists that you can read about, as Dr. Newton was suggesting, and select based on what seems to be a match between them and your values. And I think I would add, like, once you have an initial meeting, just looking for signs of cultural responsiveness in that therapist. So looking to see if the therapist invites you to talk to you about your experience as a racial being, if they, acknowledge any differences or similarities in social identity between you and them, and talk about, the fact that that might cause sometimes a breakdown in understanding because differences in worldviews and experiences, but making a commitment to, like, openly acknowledge when that breakdown has occurred and to, like, seek to gain understanding. And then also, being committed to repairing, like, breakdowns that actually do occur in the relationship when they do happen, because, therapists are human too. So it's very possible that sometimes they might say something wrong or offensive, or even, like, commit a microaggression. And so, it's not necessarily about whether or not they do that, but their response that's important. So looking for all of those signs to ensure that you're working with a clinician who is culturally responsive is also important too when thinking about attending therapy.
And I do want to say, like, if there are people who are watching and you're like, well, I don't have insurance, or I don't think I can see a provider, like, if you have Medicaid in the state of Michigan, you have unlimited access to mental health services. I mean, there used to be a cap on it, but there's no longer like a cap or certain limit for most Medicaid programs, or even going through like your local community mental health could be a start point. Or if you even don't know where to start, if you have a primary care doctor, many times they can also refer you to someone, or put you in contact if you're kind of struggling with finding someone in your area.
Yeah, and I'll add too, if you're a student, you can go to a university counseling center. If you live in the Kalamazoo area, you could go there in any area, honestly, like also looking for support from cultural enrichment centers. So like here, for example, we have the Rooted Enrichment Center. They also provide therapy services. There's the Black and Brown Therapy Collective, which is made up of BIPOC clinicians who want to work with BIPOC clients. There's a Synergy Health Center that works with Black and Brown folks, the YWCA. And also to plug, Dr. Steele and Dr. Newton, they are both owners of their own private practices. And then I know that Dr. Newton mentioned a resource specifically for Black women, like therapy for Black girls. There's also therapy for Black men. Black Men Heal, the Black Mental Health Alliance, and the Boris Lawrence Henson Foundation that also work as directories or registries to help you get connected to BIPOC clients in your area. Not clients, but clinicians in your area.
Mm-hmm.
Mm-hmm.
So before we start to wrap up our conversation, I just want to check in, make sure that there aren't any more questions or comments in the chat.
No, I think the only comment that I didn't read, but we talked about was again from Enid, and she says, if our expression of our humanity has been weaponized or shamed in systems and in family relationships, it can be difficult to embrace a professional helping relationship like therapy.
Mm-hmm.
Just kind of reinforcing some of what we talked about.
Yeah, and I want to thank Enid for their comment. So I think that goes back to what you were talking to earlier, Dr. Steele, of therapy can really be a space to provide a corrective healing experience for people, showing people that we can choose to exist and be and relate and show up in relationships differently than what's been done. And that helps us to honestly advocate for ourselves and have agency as clients in that process. Like therapy is the place where you can have that power and control. So Drs. Newton and Steele and I would like to thank everyone for joining us. If you are interested in learning more, please check out their book, Black Lives Are Beautiful, 50 Tools to Heal from Trauma and Promote Positive Racial Identity, which you can find on Amazon. I already have my copy. You need to get yours.
Yeah, I'd like to thank everyone for joining us tonight and for your awesome comments. And we will see you all next month. Thank you.